welcome everybody. In a few days, there is going to be Chinese New Year. So happy Chinese New Year to every one of you. Welcome to today's webinar. Donna's supposed to do the intro, but then I'm going to do it instead because it's my sifu speaking today. So it's my honor to be the MC. So I'd like to welcome everybody to today's class, Virtual Internship number 2. And this class today is designed to mimic the actual scenario when interning at Dr. Chang's office. Because of COVID, he hasn't opened his live internship yet at his office. Hopefully towards the end of this year, when it's safer, then you guys can go to his office, sit next to him, take patients' pulses as he takes the pulses and watch him prescribe and watch how his whole clinic works. All right. So can I have you guys type into the chat room if you are new to Dr. Chang? If you have never taken any class at all with Dr. Chang and totally new to the system, can you put your name? 1, 2, 2 new people, 3. Okay, 3 or 4. Oh, okay. So if you're totally new, don't be overwhelmed today because you're going to hear a lot of information from Dr. Chang, and it takes at least a year to be familiar with his system and another year to be familiar with the herbs. But it's okay. You can catch on to the train ride anytime and learn as much as you can as we go along. And there's a lot of people in the chat room that are veterans who are happy to help. If you have any questions, just type it into the Q&A if you want Dr. Chang to answer your specific question. But if it's just a general question you want to ask any of us, you can just put into the chat room. All right. Now, regarding the chat room, if you can look into your chat room, at the bottom, it says to panelists. I think you need to change it to all panelists and attendees. So this way, you don't just send a message to us. You send it to everybody so everybody in the class can see. Okay. And then next is, I want to introduce Dr. Chang. I don't know if I need to do much introduction. He is a very famous, one of the best practitioners in today's time, and the master of pulse diagnosis and herbal prescription. Luckily, we have him here in Los Angeles. So the patients here are very lucky. And he has been teaching for over, I guess, 20 years with us. And also he did that as well in Taiwan. So he has students all over the world. And all the students are helping their patients as well with his fabulous herbal prescriptions and special diagnostic skills. So I would like to welcome Dr. Chang today, and then have him share with us the special cases that he has found this month so that we can all learn from him. All right, so let's turn the camera over to Dr. Chang. Dr. Chang, can you share your screen, please?
Okay, you want me to share the PowerPoint now?
Yeah, please share your PowerPoint.
Okay, hold on. Can you see it?
Yes.
I'm sorry. Can you see it?
Yes, we see it.
Okay. Hi, guys.
Can everybody hear Dr. Chang okay? Please type okay or yes in the chat room. Okay, good. Your microphone is good too. Okay, let's get started then.
Okay. Today I'm going to talk about a lot of very interesting cases about everything. There's a lot of varieties, and there are some of them will be in graph. Anyway, I'm going to start talking because so many things to tell you. The first case is a lady, 70 years old, and her problem is she's been coughing for 9 years. 9 long years. So somebody asked me, why don't you use something for like external wing or something medicine for that? Because it's been 9 years, there's no external wing in there anymore. It's all internal. And she has a lot of asthma too. So the pulse will be like this. See, this is the right twin. I always use the right hand side here and the left hand side here. The right twin is like this, the little floating. So this is the lung. But this is Yang Wei pulse. In case you do not know Yang Wei pulse, you should learn my 8 extra meridian pulses. This is Yang Wei on the right hand side. If the Yang Wei is on the left hand side, it will be the arthritis, but not today. This one. So I know there's a lot of phlegm in there, and the rest of it is not so important. Let's see the ear. This one, this is the lung and chest area, is white. So I know there's a lot of deficiency in there. Not enough blood supply through her this respiratory system, especially the lower part. It's not super this upper part anymore. So I decided to give her something like this. Some Pi. Actually, I put this 3 herbs together. I pre-mix them, as you can call it phlegm 1 or sputum 1, whatever you like. Shang Bai Pi. Hold on, let me make it a little cleaner. Okay, Shang Bai Pi is for the phlegm, and Huang Qin especially designed for upper respiratory system inflammation. And Jigen, do you see this one? Jigen is for phlegm, to bring the phlegm out. So I put 3 of them together. You can call it phlegm 1 or sputum 1, whatever you like. And no, this flu one. Yeah, where's my mouse? Over here. Flu one is simply for cough. That's easy. Chang Hu, this is very important medicine. Hu, you know, we all also know that the other one is called Cai Hu, right? We have Xiao Cai Hu Tang. The Chang Hu is is different from Cai Hu. It's for bringing down all the upper respiratory system or anything that goes upward down. And cough in Chinese medicine is called an upward movement, which is not good for human body. So we're gonna drop it. We do it in the opposite way by using Chang Hu and get rid of phlegm too. And Yu Xing Cao is for phlegm. So not too much of them. This combination is for stopping the cough. Usually people will try to do something for stopping the cough, because this lady having cough and had asthma for 9 years. Naturally, you would think, oh, stopping the cough would be very important. No, I don't do that. I do indirectly. I just only the Zi one is for coughing. So I put them all together, and just once or twice, it's all gone. And this 二食汤, 二 means 2. Somebody is saying it's difficult to find the webinar. Okay, 食 is a stone. In Chinese, is a stone. So 二食汤 is some kind of a very interesting blood mover. Whenever there's a problem with the chest, you must use some blood mover. Usually, I do not. Sometimes I do for 血府逐瘀汤, but for this 二食汤 is for asthma. Try to remember that. This one is especially for asthma. For this. Okay. Okay. So also 二食汤, I'm sorry, it's not 二煮. 二食汤 is a very important factor for the neck and shoulder. Actually, this pulse is for neck and shoulder. Let me change it to here. This little turtle pulse like this, like a rainbow on the right hand side, 食, that's for neck and shoulder. Of course, neck and shoulder and chest are all connected. So I put them 二食汤. It's not only for releasing the pressure and the pain on the chest, also good for asthma. So this case was very, very successful. Okay. And for the next page, okay, the cough and lung is much better, huh? And see that the pulse here is less. So I have to. The pulse here, sorry. The pulse here is much better, and the neck is much better too. But still, this pulse, you know what this? This is the right Shaoyin on the right hand side. That means the kidney. Actually, it's not kidney, it's the hormonal. But it also shows something like a Chun Guanzi. The Chun area is very strong and upward pounding. So I think it's still some kind of pressure in the chest. And I believe because her pulse was also deep, so I'm using the damp heat, this phenomenon, this concept. I use something very interesting. Oh, sorry. This one. See, this is better. The neck and shoulders still a little bit, and the stomach. But her pulse was pretty deep, and she's very chubby, and with a little bit blood pressure condition. And most importantly, that her finger is the clubbing finger, so the something like this. Normally, the people would have no more fingernails, but her fingernail is like this, convex. The surface of the fingernail is convex, so that means there's a lot of peripheral edema in the chest. So I use 1.金, this one, 1.金to release the pressure and the water liquid in the respiratory system, and also this 20汤 to clear the phlegm and clear the neck and shoulder and blood moving all the chest, and some 白皮黄芩桔梗. This three is a group. I premix them in my office. And most interesting part is the Dilong. You know what Dilong was used for? I use for blood pressure and asthma and the chest. So, I'm sorry. Since her blood pressure is a little high, but not too bad, so I use Dilong to clean it. And the result was very promising. The most important thing is the clubbing finger. Clubbing, C-L-U-B-B-I-N-G. Okay, you can check the internet what that is about. Okay, any questions so far? Okay, this 1.金and Dilong together. I'm sorry. Yes, 1.金and Dilong and 20汤 is clear for cleaning the chest. Okay. Okay, Tina can answer that. Good. If you have any question, just don't hesitate to ask. Okay. The next case is the sugar. Okay. How do you know the patient is anemic, pale and anemic? Why? How do I verify it? By looking at the Neiguan area. I look at here. I look at this area. If that area is pale and very white, that means it's anemic. So I know something so weak about this patient. Her problem is the sugar. So how do I know there's a sugar? By using the stomach pulse. When the stomach pulse is forceful or deep or superficial, then you can tell there's a sugar problem. I don't care what the Western doctor says, but sugar in our system, in my system, it belongs to the stomach category. Whenever there's a stomach fire, there's a sugar condition. So So what did I do? Okay, she had a sugar problem. She went to the emergency room sometimes, and her sugar was 145. It's pretty high. So what I gave her was the 八味地黄丸 and the 天花粉 and 山药. It's not 芍药, 山药. Why use 八味地黄丸? For tonify the kidney yang. Even though she has a little fire, but I think she's pretty weak. So I use 天花粉 and 山药 is for the stomach fire. And M3. M3 is the combination of three formula. It's the 黄连解毒汤, 甘露饮, and the 蟹黄散. I put them all together because they are all responsible for clearing the stomach heat. So I put them together to clean the stomach heat. To clean it. So next time the sugar is a little bit better, and the reason I use the 八味地黄丸 is for her frequent urination. Whenever your sugar is too much in the blood, it will stimulate the kidney to have more frequent urination. I use 八味地黄丸 to tonify her kidney yang, so the frequent urination is a little bit better. And the medicine I used the second time, I use astringent complex. Come on, this is the best. And 五味子 Hey, Tina, can you somehow change the proportion of this?
Oh, so you don't have to share full screen then. Can you make it smaller so then you can see all the slides on the left? Then they can see all the formula.
Okay, how can I do that?
He wants to change it so it's not full screen. Okay, click on escape.
Click on what?
The escape button on the top left of your keyboard.
Oh, escape. Yeah. Okay. Oh, okay.
Yeah, so they can see the whole thing. You guys can still see, right? Okay, this way is better. This way they can see the whole herbs.
Okay. So this 夜交藤, why do I use 夜交藤? This is for her sleep. She's so nervous, she could not sleep.
Can you turn on the...
It's better.
Can you turn on the sound? I cannot hear what he's saying. Because if I turn it on here, it'll be echo.
Okay, this is good. They can see better this way, right?
Yes.
夜交藤 is for sleep, and 五味子, the 五味子 is very sour for sleep and for frequent urination, and anything sour is good for curing the sugar problem. But mostly I use astringent complex. And the next one, okay, this one. Okay, now after this treatment, I use again astringent 虎杖 and 天花粉. This one. I use 虎杖, 天花粉, flax spur. Well, why do I use flax spur? She had a back pain. In addition to treating the sugar with astringent complex, I use flax spur for her back pain. And 虎杖 is also for back pain and for sugar. So is the 天花粉. They are all sour herbs. So her blood test shows that A1C used to be 9.4. Now it's only 6.7. Not totally fixed, not totally normal, but it's much, much better. Okay?
Sorry, can I cut in a little bit? Dr.
Sure,
Chang, for some patients who live far away, prescribes 150 grams. So that's why you see the percentages add up to 150. So he gives one full bottle of 150 grams. That lasts a little longer. And he also gives them a little discount. For people who are local or people who have problems that are more short term, then he'll prescribe 100 grams.
No.
No?
No. Only for 100 grams for kids. For normal people, no matter where they live, I use 150 grams. See? Everybody.
Everybody now. Okay.
Yeah, everybody. It's more economical and easier to fix. This is, see, this double two bottles. And sometimes I always, my habit is that I give them one visit with one bottle of medicine like this. And I ask them to refill twice before they have to come in. Okay, so totally one period of treatment will be 3 bottles and 50 grams each. Then they can visit, they can make another appointment, they can visit, see how they're doing. So don't come back only after 1 bottle of herbs. I know most of you people are using 100 grams a bottle. So it's meaningless if you ask them to come back after 100 bottles. It's no use. No, that means nothing. So you have to be taken 150 grams, 3 bottles, then come back. How many grams do patients take every day? Oh, good question. And I think it's 24 grams a day, because I ask them to take 3 big spoonfuls for each time. So we measure it by our scale, and that's 24. So 8 grams each for adults. Okay.
Dr. Chang.
Yes.
Before you move on to the next case, can you explain to the new students what sugar pulse is? You can, if it's a right one, forceful, deep, or forceful, convex, both mean sugar?
Yeah, yes.
So if you see a forceful pulse, there is
like
always some sugar problem?
Yes. And it's very funny, interesting. Everything here in the stomach area means sugar.
So what if they have stomach fire, like they have acid reflux, but they don't have any sugar problem?
Yes, they have the same time. They have everything at the same time.
Okay. Now the second question is, now these herbs that you're using, do they reduce actually the sugar, the number, or they just reduce the symptoms?
Oh, not the symptoms. Symptoms is not important. I always ask them to make a record, like how many before meal, like a fasting in the morning, and take another test after 2 hours of dinner. Then we can evaluate his eating habits, the things she eats, or the eating habits or something. Basically, they must stop eating carbohydrates, including noodles and rice and white rice. And of course, no pasta, nothing like that. They can eat a vegetable and meat, anything they like, but no carbs. Then things will be better. So the sugar is not so difficult to treat. Just stay away from carbs. Then your heart better. Okay? And stop eating all those stimulating stuff like a greasy or spicy things to stimulate the stomach fire, and the sugar will come down.
Oh, that's a good tip. I never thought about that. The spicy food, right? That adds on to the forceful pulse. So Dr. Chang, go ahead.
Yeah, sure, go ahead.
The last question is, you said sour herbs can reduce the sugar. Yes. Can you explain how does it do that?
Sour stuff. You know, we have 5 tastes for medicine and for food too. The sour, do you know which Which organ the sour goes into?
Can you type in the chat room? Anybody know? Everybody says liver.
Huh?
Everybody says liver.
Yeah. And that's all? Okay. DM2 is not pancreas problem. Yeah, earth. Okay. So sour things cure the liver, and liver will help the stomach, which governs the sugar, and also liver, of course. But majorly, my astringent complex is good for any kind of inflammation organs in the human body, including arthritis, gout, joint pain, the inflammatory joint pain, inflammatory respiratory system, any swelling tissues with a fiery pulse, you can use astringent. Sugar is just one of them. Is that clear?
Mm-hmm. Okay, so for those of you who are new, Dr. Chang has been teaching for many, many years. So he has developed a lot of formulas that he found effective in his clinic. So those ones that he keeps on using year after year after year, we made them into a formula and we give them a name, an English name that's easier to remember, like astringent complex flex. SPR stands for spur, bone spur. So there are a lot more formula that he has invented, but we didn't make them into formula because those are either smaller formulas or he modifies them. It's not not a mature formula he consistently uses all the time. So these formulas, you can go to the clinical manual to read the ingredients and the functions a bit later. But for the class, he will just tell you how he uses them. So this astringent complex is what we call the herbal prednisone. It reduces inflammation and all the associated symptoms of redness, swelling, pain, etc.
Pain, and pain too. It's so good for all the pain. You don't have necessarily use the 乳香没药. Just astringent is good enough. Very amazing. It works a lot just by learning that astringent. If you learn how to use astringent complex today, then everything is worth it.
Okay. Clear. Since you're on this topic, for those of you who are new, the difference between using astringent complex and, for example, like a 乳香没药, which is a set of blood mover, right? So 乳香 and 没药 is mastic and myrrh. It moves blood, release pain, and it's used for like trauma or blood stasis type of pain. But astringent complex is more of a formula to reduce swelling, reduce inflammation, but it doesn't move blood.
Yes, doesn't.
So it depends on what kind of problem you're dealing with and what kind of pain. Now, if you're dealing with, for example, like a broken bone, then you can use the 乳香没药 as the main part of your formula, but astringent to reduce the tissue that are swelled up. But if you're treating, like, for example, post-COVID lung inflammation, then you would use the astringent complex to reduce the tissues that are swelled up, right?
Yeah.
You wouldn't need to move the blood as much as reduce the swelling. Is that clear for everybody? And Hans, actually a very good question. Astringent complex is not really sour, is it?
Is it? It is.
It is?
Maybe not a taste, but it is.
The effect is sour, right? It astringes, reduces, but when you eat it, it doesn't taste sour.
Who says so? I take it all the time. It's very sour.
It's sour? Very sour?
Yeah.
Okay.
Okay. Any questions?
Oh, how long does it take to treat the sugar? 1 month, 2 months?
Depends on the people, on the condition. Nobody can tell when.
So if they're complying with the carbs, we should tell them, like, we could see most people see some results within a month.
I don't know.
Hard to say, right?
There's no definite timeline because people have bigger. They have a body type thing, or pet or something, or the terms of the problem, how long it's been like that, the eating habits, do they exercise, do they listen to the doctor's advice not to take any carbohydrates, they behave or something. A lot of things can cause this problem. But anyway, we do it without considering all those funny factors. Just giving the medicine, it works. Any questions? Okay, let's go to the next one. This one is for allergy and this one is funny. Okay. Hold on. Okay, the sugar. Oh, sugar used to be, the A1C used to be 9.4. Now it's 6.7 only after just a few months. Okay, the next one is the sugar. I'm sorry, it's the skin problem. The skin problem, how do you make a diagnosis whether if the patient have skin problem or not? And this is the point.
Where?
Here.
And what do you see there?
Yes, this. Okay. I don't know how to enlarge this.
No, we can see, but what are you seeing there? Like redness, rash, or what? Bumps?
This section. Upper
What?
part is intestine and the lower part is stomach. In the middle, on this ridge, if there's a little bulb there or something swollen, then it's skin. This area or this area too. It got nothing to do with allergy or something. Just the skin problem will show here. I don't know why. It just does.
And what kind of skin problem?
I don't know. That depends on the pulse and other conditions. Just we can tell this word is the skin. The skin problem, you can identify the skin problem from this area. And for pulse, first, the people will have this dampness. The pulse will be deep and also with stomach fire because the skin area is so close to the stomach. So I also use something for the stomach heat. Now, this is the formula I use for this lady. Okay, she's very jumpy, and we say there's a lot of fire. And for allergy, it's not necessary. Anyway, I think the white, this is the white tiger for you. 白虎汤. Oh, here. 白虎汤 is for surface heat. So I clear the surface heat. 白花蛇舌草 and 半枝莲 is for two category. First is for the large intestine. Try to remember this. This is very, very important. The 白花蛇舌草 and 半枝莲 is for colon, large intestine. No matter it's diverticulitis or colitis or gas or whatever. And also good for skin, for all kinds of skin problems, because large intestine governs the skin surface. And most importantly, this two combination is for urination retention, for the urination problem. The PP cannot hold, cannot empty the bladder enough properly, like people with a prostate problem or something like that, UTI, something you can use. They could not pee cleanly, so you can use this 白花蛇舌草 and 半枝莲. And also it's good for liver too. So these two herbs are very popular, very famous in Taiwan for this kind of problem. And 白虎汤 is for surface heat. Anything you see the face, okay, surface, we can see the surface. If you see the patient's skin is so red and a lot of stuff, you just simply use 白虎汤 to clean it. 白虎汤, 白 In Chinese, it's white. Who is the tiger? Oh, this is the year of the tiger. Bai means surface. Anything that's white, that goes into the lung. Lung governs the surface too. So I use 白虎汤 to clear the surface heat. And 跟黄芩黄连汤, this is very typical for enteritis or diverticulitis for colon problem. So why the colon? Colon is Yangming. Yangming also governs the surface. 五黄散, oh, it's cold enough. 五黄散 is 五 is 5. Huang is yellow. In Taiwan, any herbs with the name Huang that is anti-inflammatory. I put 5 of them together. If you know what's in there, this is 大丁黄. That 虎咬黄, 鼠尾草, 柳枝黄,
鼠尾黄.
茶石黄. You don't have to remember that. Just use just buy it from Tina. 五黄散. Then it's for anti-inflammatory, for all kind of inflammation. So this project, this case is very successful. So now I'm using this for the surface heat. Actually, I should have added a little astringent too. Okay, I'll try it next time. Any questions? So we fix all these herbs, formula, and herbs together. How much should they be taking? Yeah, I told you 24 grams a day. 白虎汤 good for acne? Yes, but not enough. You should add a little bit astringent to it, or the 5 yellow or something. Is it just the stomach pulse? Yeah, this the way I draw it is I was emphasizing the stomach fire. Okay. Can you explain difference the anti-inflammatory action between 五黄散 and astringent compound? 五黄散 is like putting a bucket of ice water over a pile of campfire. Astringent complex like taking away all the burning woods out of a campfire. It's a little bit different. Why did you choose one versus other between two cases? I don't know. It's my heart and my inspiration. Okay. What's the next one? Okay, this one. Okay. Sorry, can you? Okay, this one is interesting. See this area? This area is the colon, the large intestine. So, see this two area? Hey, how do I reduce the area of this?
Reduce the.
Okay, you can see it now. See these 2 points? That's the colon. It's all red, and the right side is pretty floating. So, his problem is the bleeding in the stomach, in the colon, like this. And I see too much inflammation, but his problem is stomach, also stomach sugar, and the colon and hemo, bleeding and heat of the fire. So I give him 真人活美饮 and this too. Okay. This 真人活美饮 here, 先方活美饮. this 照角刺 and 入风房, this together is for hemorrhoid, for any swelling, varicose veins or the hemorrhoid. And the 先方活命 is like a spike that can destroy all the swollen tissues inside the anus. And clear heat one is a combination. It's a little bit complicated. Clear heat one is this astringent complex. How do I move this? Astringent complex 真人活命饮五黄散 and the liver detox for the clearing heat. You can pre-mix it in your office. This one, clear heat. I mean, this one. It's very effective. If you find any pulse, no matter where, the heart, lung, whatever, the leg, even the neck and shoulder, headache, hypertension, if you see the pulse, if it's jumping and pounding hard, then you can use the clear heat number 1. You can call it whatever you like. Liver detox, astringent, 真人活命五黄散 equal. Okay? This is my secret formula. I never revealed it before. So, 五黄散 is more to clean heat from the head. 消泻风消风。先方活命 how this one? It's the same thing. Same thing, exactly the same thing. Okay. So I'm using this to clear all the heat. Actually, it's also good for any kind of a pus. As long as the pus inside the human body, the pulse will be fast and with a little bit of fever or something, not necessarily in the anus. So whenever there's a fast pulse with a fever, you can directly use this combination. It's so good. And his complaint is the bleeding from the anus. But I didn't use any black one, but I will use for the next case. I don't think there's too much problem. All I need to do is to destroy the heat, clear the heat with my astringent complex. The bleeding will stop. It did stop. Okay. Any questions?
How fast is the pulse when you say fast?
It's over 100 or something.
Can you give us some examples of problems that have pus that you see in your clinic?
What do you mean?
Like
What do you mean example?
examples of diseases, like a tonsillitis?
Yeah, anything. I don't care. I don't care where the pus is. I just use it.
So for those of you who are new, Dr. Chang takes the blood pressure and the heart rate for all the patients. So I have a article that I wrote for, how to tell what that all means. Let me put the link in the chat room for you.
Okay, this next case is somehow a little bit for very commonly seen cases you will encounter every day in your office. But for the people you are new around here, you should know that my philosophy is that we don't ask. Whenever the patient sits in front of you, don't ask, how do you feel? How can I help you today? Don't ever ask that. All you do is ask nothing and start taking the pulse, do my whole system examination, diagnosis by the hand, by the snake one area, by the ear point, by the pulse, then like do everything thoroughly. And then you can ask, how can I help you? What do you want me to do for today? That's the only thing I ask from the patients. Do not ask them, how do you feel today? What can I help you today? In the beginning, if you do that, people don't have respect for you. They don't think you are a good doctor. They just think you are a medicine prescriber, just like some Western doctors. They go to the Western family doctor, doctor say, what can I do for you? Nothing, just give me the prescription of my professional medicine. So you become like a worker, not an artist. We are the artists. We do our medicine with art by not asking patient in the beginning. Do you get it? Then I explain it to them.
It builds confidence. If you can tell your patient what they have before they tell you, then you have the placebo effect working all towards your favor. They'll think whatever you're going to give them already works. And when they think that, it just works that much better.
Okay, this case is generally for the mood, for the back pain or something. The pulse like this will be, the neck pulse will be here. Has everybody attended to my previous class before here? The right shi is strong and like a concave, a convex turtle back. It means the neck and shoulder. The left shi is wiry. That means the back, the low back. And if we're very deep and scattered, that means old injury. You can verify it from the ear point, but this one doesn't have it. So the major point is the liver, neck, and shoulder joint pain, back pain. So this combination, black spur 100 and Centon 50 is the typical combination. If you do not know what to use in your office when the patient sits in front of you after you examine them, then you just simply use this. It works all the time, especially for long term of pain, because the longer the pain is, the more stagnation there will be. So use flex spur and Centon 煮鱼汤. But for new injury, soft tissue damage, or maybe the patient twisted his back just a few days ago, then you must add astringent complex. Okay. And there's another interesting combination.
Does it make sense, everybody? Do you guys know? So let me explain a little bit more. He said that flex spur is more for long term, because what we found is, because this formula is for bone spur, right? And we have found ever since maybe 5 or 6 years ago when we start using this formula that it's very good for any bone related pain. So if there's any pinched nerve, sciatica, any whatever's wrong with the spine causing the pain, flex spur is great, especially for bone spurs. Now, John got like a couple cases last year of patients who actually went to take x-ray before and after, and the bone spur actually dissolved. Amazing. So what he's saying is, for chronic cases, you add that because usually something's wrong with the bone. And then Centon 煮鱼汤 is a blood mover, right? And also relieves pain. So this is for chronic type of pain. But for acute pain, you want to use the astringent complex, because in acute pain, there's usually a lot of inflammation. Nothing wrong with the bone usually, right? Structurally. So it's more important to move blood, reduce inflammation, reduce pain. So that's a difference in approaching different types of pain with different strategies and different herbs.
Okay, so the next visit, this is the refill. I changed my herbs a little bit. I'm starting using this combination. 乳香没药, 100%. It's not 100%, 100 grams. So this is for all the stagnation and pain and everything. All kind of pain, not necessarily neck, shoulder, or back. But this is most interesting part. 金鳞紫散 is a combination of 川楝子 and 岩土. This works like a muscle relaxant. Western doctor always like you use for the pain for this. I use this non-steroid painkiller and add little muscle relaxant. Muscle relaxant, it might take 2 weeks to start working, but our Chinese medicine works much faster. The 金鳞紫散 can work immediately. 金鳞散 for losing what? For losing tight pulse. That means all kind of tight condition inside the body, like a tight tube. You know what I use for that? For people who have gallstone or kidney stone, because gallstone or kidney stone always happen in the middle of the night. So people have the pain, they don't know what to do. So eventually I give them this Jingling and an extra pack of herbs. If the pain started, just take it. It will release very fast in a few minutes. So Jingling can release very tight tube inside the human body, including the muscle tightness, or the head, the neck and shoulder, muscle like a twitching or anything. Jingling is so beautifully can achieve the success. So try keep that in your mind and make sure you have it in your clinic. Okay.
So Dr. Chang,
yes.
Does it relax the brain?
Yes, absolutely. I use them to help them sleep better by not the brain, the neck and shoulder, the Taiyang channel. To read it. Oh, it works so well. You can try it tonight.
So how does this compare to the effect of 芍药甘草汤?
芍药甘草汤 is also, I use it together. But 芍药甘草汤 is more for abdominal muscles, like ladies, the period cramps. Actually, I use them all together. So okay. I can use 芍药甘草汤 here too, but I just use that. Can't remember why, but maybe just thought.
So going back a little bit, there was a question on how do you use Centon 足鱼汤 and how is it different than 舒筋活血汤?
I never use 舒筋活血汤, it's no use.
Okay, so how do you use Centon 足鱼汤?
Anything with the old injury or blood stagnation or joint pain. Explain a tight pulse a little bit more, okay? The pulse supposed to be soft, the vessel. If the pulse becomes like this, when you press down, the rebound is very stiff. Then we call it tight pulse. If not, naturally, the blood vessel should be very soft. But when it becomes like this, when you push the bottom, push the vessel, it becomes so hard to make it down. That's the tight pulse. 透骨草, you can use that. I don't know. No, wiry. It is so wiry. Of course, the tight pulse is definitely wiry. What change in the pulse that makes you think? I don't know. It's my inspiration. Okay. The next one. Oh, this one is interesting. Okay. This pulse, the right twin, actually, the whole right twin is scattered and soft. So, what do you make of it? What do you think a soft and scattered pulse mean? Say something. What does pulse mean? Anybody?
Yeah, people are saying in the chat room, blood station, damp, weak lung.
Yeah, you're all correct. But it also means this. Hemorrhoid. A weak hemorrhoid. So not very stiff, not very inflammation, but he has a lot of bleeding. Hemorrhoid. So next time when you see a scattered pulse on the right twin, you make sure this area is not very clear, where the hemorrhoid should be, but not very clear. So anyway, I still feel this is a hemorrhoid, and with the bleeding, okay, heavy bleeding. So this is the formula I use. black one. Okay, black one is very simple. You don't have to remember what's in there. You just order all the black herbs you can think of or Tina can supply. Then you just mix them all together. 鹿芬芳、五倍子、黑子、刺柏叶、皂角刺. Actually, it's 皂角刺 just like 鹿芬芳, like we mentioned earlier. And this actually, this is the combination. This is the astringent complex. I don't know why I use them separately, but this is my habit. Okay, you can use the astringent to here, plus this black one. And the effect will be immediately. See, you can see the result very fast. Okay, this is for hemorrhoid. As for hemorrhoid, also you can see, let me draw a picture here. It's the eye, okay? If you see something like this, red lines in eyeball, when they touch the eyeball in the middle, then it's hemorrhoid. And let me give something for bonus. Okay, I'm gonna do another drawing of the eye. This is the eyeball pupil. If you see some red line here, and with dark spot at the end of the small vessel, this is the pupil. Okay, you know what that means? Okay, your eye is blue. Okay, fine. This means something frightened this patient before. She is very scared and she has some emotional issue, very terrifying experience in the future, in the past. Then you can tell also the pulse that she needs a lot of a Chinese medicine tranquilizer to help her with the emotional, breakout something. So you can directly tell she or he has been suffered from some previous experience of being frightened and somehow scared. You know what I'm saying? Okay, let's go down to the next one. Any questions? You can look at your patient's eye, very easy. So this is for hemorrhoid and bleeding, especially the black one. I suggest you have this pre-mix in your clinic. If the lady has a very heavy period, a very heavy bleeding from the rectum, or even from the so-called diverticulitis, bloody stool, or in the stomach bleeding, any kind of bleeding, nose bleeding, whatever, especially heavy period, you should have this handy by mixing them in advance in your office. Okay, just order whatever you can. The ton means black medicine. Ton. Okay, just order them. Not necessarily everyone. You just get whatever you can get. Okay. Okay. And this one is again. This one is interesting. Okay, the right one again like this. This is a male. The right one is like this. The right one, the stomach is floating and with a lot of inflammation. And the reason I use a brown color here, that I feel the pulse is no rebounds. the pulse doesn't rebound, just like a very dead fish down there. So I use brown color. I suggest you can use this this chart for your daily practice, and I always suggest you use some crayon, colorful crayon, to know to show yourselves the nature of the problem. And for the eye, sorry, for the ear part, you should see a lot of different colors in there. So you must have some different color of ball pen or roll pen, roller pen, whatever, to make the color. See, this one, this guy has a, I use black, means the ear, on the ear, it shows black color. So I use this as kidney, something block his kidneys, and the liver, and the head, something in his head. Why in his injury? Because he's a strong, hard-working man. Injury in the head, so it's black. And this is the redness here. And again, means the inflammation, maybe something swollen in his head. So his major complaint is the back joint pain, heat, stomach headaches. The headaches here. So this is the Shao Yin Mai. The Shao Yin Mai, even is for measuring the hormone level, but still they have Chun Guan Chi. So the Chun is too high, too strong, means this guy is very stressful and maybe have too much hormone bothering him. And the Chun means headaches. And stomach, definitely stomach. But I didn't use much medicine directly for stomach. This Shao Yin Mai on the right hand side, if it's on the lady's wrist, a lady's right hand side Shao Yin Mai is a very strong rebound. You can directly tell, hey lady, you're so bossy. They always laugh after hearing I say that. And her husband will laugh too. She's very bossy and stressful, difficult to handle. So I give him this 生痛足浴汤、正骨质金丹 and 普银。普银, this one is for any kind of inflammation and pain. You can use it astringent as well. I just don't know when. I didn't remember when. Why I used that at that time. But just the inspiration. So I use it, and it works very well. And the next one, this is and the next pause. Hold on 1 second. Okay. So next time, even I didn't use anything for the stomach, but the stomach gets much better by using all this stuff. Okay. You can also use this for any kind of old injury, especially for those big, chubby, hard-working men. They always have injuries on there everywhere. Not necessarily sports injuries, but from working and a lot of stress, they have dead blood, stagnation, and pain. Pain will have inflammation too. You can use Puyin or astringent complex, whatever you like. Okay, the next one. I don't remember the time level, but okay, so many questions. Left Chun, that means arthritis, blood stasis. What's the nature of black one? What's the nature of black one? For stop the bleeding.
I think she means temperature. Is it hot? Is it
cold? What?
Hot formula, cold formula?
HPV? No, this is not our subject today. We'll talk about it later, maybe next month. Weak immune system will not appear on the ear. Sorry. Deficiency? Okay. Okay. This guy, maybe I mixed up with the orders, but anyway, On the May, his creatinine, that's the most important factor for measuring kidney function, was 1.47. On the August is 1.24. It's much better. When I was young and I was working with the military once for a special project in a military hospital in Taipei. It's the General Military Hospital. The reason I was invited in that group because they have a difficulty treating nephrotic syndrome. Those things, when it happen to all those young soldiers, they can give him nothing but steroid, the prednisone, sometimes up to 100 milligrams a day, and the water pills too. But they cannot cure them. Sometimes they make a damage to the kidney and the liver and the bone structure. So those young soldiers will be sitting on a wheelchair for the rest of his life, and the kidney is still not cured. So they are out of hands. So they asked our Chinese group to move in. We bring some Chinese herbs into that general military hospital, and we cook the medicine there. And one of the doctors, the Western doctor, gave a speech that if you can change or lower the creatinine number by any way, you'll be an international expert in kidney diseases, including nephrotic syndrome. He was so reluctant to admit that because Western medicine, including the prednisone, can do nothing about it. So now you can see I can do it, and we can do it too, just by using the simple herbs. So simple. Okay, I lowered too, and the BON was better. The EGFR was better. Right? But anyway, and this is Taiyangmai, the kidney, and this is the liver, and this is a Shaoyin, too strong. So I give him astringent complex liver detox. Use Puyin again for his neck and back pain, something like that. Astringent is very effective for treating kidney deficiency and kidney inflammation. I have a schoolmate. I use astringent 100% to give him to lower his creatinine, but he didn't come. Afterwards, he was forced to do acupuncture by somebody. And finally, he passed away from heart failure. Heart failure was called during the operation. He died in the hospital on the surgery table. That's very pity. I lower I strengthen his kidney function by simply use astringent complex. But his wife is very nosy and very dominating. Too many suggestions. So he stopped coming to my office, and then after a year or something, he passed away. But anyway, astringent is so good. Just keep it in your office all the time. And for the next one, okay. And for this one, oh, okay, the same guy. Oh, poor guy. Okay.
This is a question, Zhang Shi.
What question?
Yeah, the question, what's the difference between using Puyin versus Zhi for inflammation?
You can use, no difference. You can use it.
Either one the same?
Yeah, it's almost the same.
When do you pick one versus the other?
What?
When do you use Puyin and when would you use Zhi?
It depends on my on-site inspiration. No definite rules for that.
Okay.
And for the same guy, his left foot is so deep. It's also for arthritis, and his artery is a little hardened, and he had a also had a problem with the heart. 3 bypass operations, heart, chest open, heart opening, open heart surgery. So I'm using 20汤, 20 like we talked about earlier today, and 血府足浴汤 and clot combo to clear all the chest stagnation. And he refilled so many medicines because it makes him feel so good. 20汤, 穿破十箭穿, 十 means stone. Whatever, you don't have to remember that. Just order it. 血府足浴汤 is a very typical herbs for chest, for clearing the chest. And clot combo, this is the most important. 乳香没药、三仁而足 and 圆胡手 for calming the nerve and for the inflammation, for all the blood stagnation. Okay, kidney stone formula. Okay. And this time, he asked me to take care of his prostate and still kidney. I say, so I use 结石方 the kidney. I use many combinations, different times. Okay, you can see it. I use kidney stone formula. Hina has it. It's KS formula. And 阁下足浴汤, 阁下. Game is diaphragm. So under the diaphragm, where the kidneys are, I use 阁下足浴汤 to clear the blood flow, making more blood flow through the kidney to increase the kidney functions. And code breakers, something like that too, to break all the blockage. You can use the club combo too. 三人而足，王不留行. Oh, this one. This one is so good. 含羞草. You know, we don't have it anymore in our in Tina supply, but we can, you know, you can get it from Amazon. Amazon made it into capsules. I don't remember the name, but maybe I'll tell you later. So you can get it from Amazon in capsules. You can take them for the kidney function. This is also good for kidney. The major sorry. The major philosophy for increase the kidney function is by pushing more blood flow through the kidney. Kidney is just working like a water filter in our home. So the water filter is stuck, the function goes down. So the major philosophy, the approach to increase kidney function is by pushing more blood through the kidney, so it can work properly. Just like enhance the circulation, get rid of the traffic jam, and the kidney will go back normal. So 阁下足浴汤 and this kidney stone formula, cold breaker, hot breaker, whatever, just destroy them.
Okay, so before we move on to the next case, the last case, you see how he used 阁下足浴汤 to move more blood to the kidneys. If you are not in his WhatsApp group, you probably missed this conversation, which is I asked him, isn't kidney in the lower jiao? Why do you use 阁下足浴汤 when that's a formula for the middle jiao? Don't you want to use 少腹足浴汤 or 折冲饮 for the lower jiao? And he said, where's the kidney, Tina? Then I thought, oh yeah, kidney is in the middle jiao, the actual kidney. So he's using the formula to push blood to the actual kidney, not for the kidney functions, the TCM function per se, but more the Western kidney, the actual anatomy. So before we go on, let's take a 5 minutes bathroom break, Dr. Chang. We'll take a break, okay? Before we move on.
Okay, don't go. Wait, we'll start talking.
Okay, 5 minutes.
13.
I'm gonna send you a link to visiting Dr. Chang's office. This is when Ivy was with Lotus and she took a field trip to Dr. Chang's office to show everybody what it looks like and how he mixes herbs. Enjoy.